We have now lost 2,028 people in West Virginia, and it's a tragedy beyond belief. Keep all these people in your prayers, please do. But thank goodness this thing at least appears that it is really turning and turning our way. So we're just going to keep doing the good work that we're doing and hope and pray that God above will move this thing away from us and it'll be gone forever. But the 2007th death is a 68-year-old female from Monongalia County. The 2008th death, a 92-year-old male from Wayne County. The 2009th death, a 66-year-old male from Boone County. The 2010th death, a 78-year-old male from Work County. The 2011th death, a 67-year-old male from Grant County. The 2012th death, an 87-year-old female from Cabell County. The 2013th death, a 67-year-old female from Mercer County. The 2014th death, an 87-year-old female from Lincoln County. The 2015th death, a 69-year-old male from Pleasants County. The 2016th death, an 85-year-old female from Kanawha County. The 2017th death, a 47-year-old male from Pleasants County. The 2018th death, a 92-year-old female from Kanawha County. The 2019th death, a 90-year-old female from Kanawha County. The 2020th death, a 57-year-old male from Wood County. The 2021st death, a 59-year-old female from Berkeley County. The 2022nd death, a 74-year-old female from Boone County. The 2023rd death, a 74-year-old male from Marion County. The 2024th death, a 76-year-old male from Jefferson County. Hold on just a second. I may have read this wrong and everything. I may have got it right, but if I got it right, I'm just going to do it again. The 2022nd death, a 74-year-old female from Boone County. The 2023rd death, a 74-year-old male from Marion County. The 2024th death, a 76-year-old male from Jefferson County. The 2025th death, a 63-year-old male from Fayette County. The 2026th death, a 93-year-old male from Cabell County. The 2027th death, a 78-year-old female from Wetzel County. And the 2028th death in West Virginia, a 79-year-old male from Wood County. Don't let them become just a statistic. Please, please, please keep them in your prayers. We had 424 new positive cases in the last 24 hours. That's amazingly low compared to where we've been in the last little bit. I think, though, you'll find that it's due to the number of tests because our testing was down. Our daily positivity rate was 8.03. Our cumulative positive is 5.62. Now, these are numbers that really, really, really mean something. Our active cases are 20,615. That's 16 straight days that the number of active cases in West Virginia has gone down. So that's really good. Our recovered cases are 98,782. Good. Really good. Put the graph up, Jordan. You've got that. You see it. It just keeps widening and widening and widening. That's great. Now, 438 patients are now hospitalized in West Virginia. That has dropped, and get this really good, that has dropped by 46.5% since peaking at 818 on January the 5th. We're at 438. We peaked at 813 on January 5th, and God forbid that we don't ever go back there again. This is the lowest number of hospitalizations in West Virginia since Thanksgiving. We have 118 patients in our ICU units, and we're now down to 12 counties that are red, that are currently our red counties. And Jordan, put that map up if you would, that show just our red counties. See now we're really, really making it. We're still struggling with, for the most part, some border counties, but West Virginia is getting better and better. I remind all those that are 65, all those that are 65 years of age, that please, the second that you feel the least bit bad, no matter what, you absolutely have got to get tested. Please get tested. As far as because let me fall back on that, just to make sure everybody knows, if you get tested and you test positive, we'll get you the antibodies and everything and be able to shut this thing down and shut it down really quick. Otherwise, if you let it go and let it go and let it go, you could very well become another casualty, and we don't want that. The vaccine distribution update. This week, we are still doing incredible work in regard to the vaccine administration rate. For last week's allocation, now just get this number. For last week's allocation, our administrative rate was at 108.1% of what we received. It's amazing. On first round doses, we're at 70% on the second round doses. But just think, we continue to lead the nation. We're on every broadcast everywhere. West Virginians, you are looking great, and we just got to keep making it better and better and better. How do we do 108% of 100%? Well, it's real simple. We're getting more out of the vials. We're getting more out of the vials and not throwing the vials away. We're using them in every way, because that life-saving drug does just that. It saves lives. To date, we have given shots to 262,808 West Virginians. 880 West Virginians. That is 194,000 of the first round doses and 68,000 of our second round doses. We are pushing them like crazy to get more and more and more vaccines. I'm very, very hopeful to be back on the phone with the Biden administration with their coronavirus czar here in just a little bit. And believe me, B, I'm pushing just as hard as I know how to push, and so are all our people. We did get a trickle more vaccines. We got 3,700 more of the Moderna vaccines in this week, and we're just going to keep pushing and pushing to try to get more and more. As far as the vaccine scheduling system, we are pre-registering all those above the age of 16. And since we launched that pre-registration system on last Monday, a week ago, we have registered 156,288 West Virginians. I encourage all West Virginians to pre-register. It takes about 10 minutes. You will not lose your place in line if you're on a wait list somewhere else. Get pre-registered. It will just help all of us, and please, please continue to stay on top of this. And if by chance you don't know how to go online and do the work and everything to get pre-registered, just still call us, and all of our numbers are up there and everything. Call us, and somebody will help you get all this registration stuff behind you and done. This week, vaccine clinics will be held in all 55 counties in West Virginia through our Operation Save Our Wisdom. And Save Our Wisdom is just that. The elderly that we're losing are our wisdom in this state. And we've lost way, way, way too many. The clinics are available for West Virginians that are 65 of age and older. The full list is available on the website. Residents from any county in West Virginia may access an appointment at any of the vaccine clinics listed, regardless of their county of residence. Many clinics are utilizing existing wait lists. I want to again encourage anyone over the age of 65 to call or go online to register through our online scheduling system. Everybody needs to realize we do not have enough vaccines to do everybody right now. We're pushing, and we're going to continue to push, and we're going to continue to get out every single vaccine we have. So far, this is a really wonderful number to me, but so far we have gotten shots to 92,482 of our people that are 65 and older. I ask you over and over and over, how many lives have we saved by just moving? Not being like the other states, we just moved, didn't we? We reacted. We did the right stuff. We've gotten 92,482 shots in arms of our people over 65 and older, and the odds are we have saved thousands of lives. No number on these pages could please me more than that. As far as our long-term care facilities, there have been 18,041 long-term care facility residents and 20,427 long-term care facility staff who have chosen to be vaccinated, and 19,694 school employees have also chosen to be vaccinated. And those are all done. Our vaccine hotline or info line is up, and Jordan, if you'll throw that back up there. Vaccine reminders is, absolutely still your best defense is wear your mask. Your next best defense is absolutely when you have the opportunity to have this vaccine given to you, for crying out loud, take the vaccine. You cannot get COVID from the vaccine. You will not grow antlers from the vaccine. Please get your vaccine. As far as if you have been blessed and you have absolutely recovered, it is a blessing from God above that you weren't one of the casualties. Please go give blood. Please go give plasma. We need that so badly. And even if you haven't had any problems whatsoever, we still would surely welcome your coming and giving blood. I encourage all people to take advantage of our free testing. Our free testing map is up there. Our drive-through pharmacy testing is up there. Again, Truth and Walgreens, thank you so much, for all you've done as well. As of today, we have 68 outbreaks in our long-term care facilities. That's substantially different than normal. I mean, we've been like 117, 115 forever and everything. That's way down. The churches, we've done the same thing as well. We're down to 6 outbreaks there in 5 counties. That's Clay, Hampshire, Nicholas, Summers, and Wetzel counties. And so from the standpoint of our church community and everything, great work. Keep a pew in between you. Wear your mask in church. And if you're elderly, 65 and above, please think about just staying home, getting your vaccine. We're just really close, really close. So let's stay at it, okay? Now, as far as corrections, let's get this number. Think about this. I mean, think about how high this number was in the hundreds. We're down to 23 inmate cases in West Virginia, 37 staff cases. No facility in our state has more than 8 inmate cases. I mean, man, that's good stuff. That is good stuff. All this looks like progress. We don't want to let our guard down. We know how fast this thing can double back on us. Wear your mask. Please wear your mask. Give blood. Know the antibodies are waiting for you if you'll just get tested. You've got to get tested if you have any symptoms at all. Go get tested, and we'll get you the antibodies. From the standpoint of COVID, that's my report to you today. But I've got one other part that I want to report to you, and it's just this. I've told you from my standpoint as your governor, the first thing and foremost that I've got to do is look out for your health and safety. And I hope and pray that you know by now by being with me so many times that I've done exactly that. And we have punched the right buttons in West Virginia, and we are the third oldest state, and we are the most chronic illness, we have the most chronic illnesses in West Virginia, and yet our numbers are only a fraction of what a lot of other states around us and all through this nation are. You have done great work, West Virginia, because we've stayed together. You've stayed right with me, and I've surely stayed with you, and that's the way we have to be. We are absolutely, without question, the envy of the nation and the diamond in the rough that everybody missed, and absolutely it will pay wonderful dividends as we go forward. But the dividends that it's paying to us is we're saving people's lives right now. Now, with all that, that's the number one responsibility of me being your governor. Now, the second responsibility that I have is absolutely to maintain and watch after the store, is it not? I've got to make sure that the economics of our state continue to work. Because if the economics fail, for all practical purposes, the services and everything that we do in government for you and everything we're doing throughout our land really becomes almost impossible to do. So with all that, I report to you today terrific news, off the chart news. The January books have now come in at $46.6 million ahead of budget. The January revenue surplus is at $46.6 million. The January general revenue fund collections were $444 million. You know, our year-to-date collections are $173 million above estimate, and $4.7 million above last year. And last year, at this point in time, we really didn't hardly even know what COVID was all about. You know, only a few weeks before now did we really start getting the impact of what COVID really was about. Now think about this, just think about it. West Virginia in 1 month has collected $46.6 million above surplus. I hope to goodness that we will absolutely continue to drive ahead in every way. In addition to that, remember that we have sitting in the wings back behind us $200 million of income tax collections that we collected in July that are in this fiscal year that are not in this number. They're not in this number. We have a cash surplus in this state right now that is extremely healthy and extremely large. We have a surplus above budget that is extremely large at this point in time, and we're going to hope and pray we continue to grow. Now, it ebbs and flows just a little bit as how collections come in and when people pay during the quarter of the year and all that kind of stuff. But we'll continue to watch it. But absolutely, without any question, we will continue to try to help in every way. I am very hopeful from the standpoint of the federal government that there will be an additional stimulus package that will be flowing out of Congress in the next few days. I hate like crazy to say this, but it's just fact. You know, the stimulus package that came out probably, I don't know, a month ago, you know, and now there's going to be an additional stimulus package come out. And just think about the election and everything. We went through months that we didn't get the stimulus package passed because the Democrats and Republicans were in a food fight in Washington. It was the most ridiculous thing I've ever seen in my life, with people all across this nation and people all across our state that were hurting. You know, our businesses were blowing up everywhere. People were sitting wondering how in the world they're going to pay their electric bill or pay their rent and everything, and it was just plain awful from the standpoint that is the very thing that I despise beyond belief, and you'll never get me to make a difference in my mind between Republicans and independents and Democrats and everything, because at the number one responsibility that I have and will always be this way is to absolutely be a West Virginian, be an American, first and foremost. Now, we have different views and everything, and I surely support the Republican view and everything, but with all that, I want to try to help everybody, and that's exactly what everybody in this nation should be. We may disagree, but we don't have to get vapor locked. We do not have to get in a situation to where we're trying. It is more important to come out with a win, Republican and Democrat, than it is to do something for somebody that's hurting. Like it or not like it, but that's exactly what we've done in Washington, over and over and over. There was so much hatred towards Donald Trump that people would have done anything in the world to hurt him. It's really sad. It's really, really sad. And then you got people on the other side that just failed to move and wouldn't move and everything, probably because maybe their hatred towards the Democrats. I can't stand that. And really, at the end of the day, I'm not going to be that way. And so with all that, I celebrate beyond belief. You know, this great thing here at $173.8 million above budget, that's great. And a cash surplus significantly higher than that. And with stimulus money, and we took care of the CARES money the way we should have taken care of it, and literally from the standpoint of protecting our businesses about gigantic unemployment rates jacked up. And so with everything, West Virginia is poised for growth and diversification and lots of good stuff. And so we're just going to keep it coming, West Virginia, and keep this ball moving, and hope and pray as we ride off into the sunset, everybody in West Virginia will be feeling better and be prouder of who you are, and you should be, because you're the best of the best in my book. Thank you so much. That's all I've got.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. I want to highlight today the work the Governor's talked about from the folks in the Joint Interagency Task Force. You've heard us talk a lot about different agencies. There are a couple agencies that don't get talked about a lot that I'd like to highlight today. West Virginia State Police, State Fire Marshals, Department of Agriculture, and Division of Corrections work hard with us each week to make sure that we get deliveries from the hubs out to the points where they need to go for vaccination. So we appreciate their work. Also, Governor's talked a lot about the great work that the group has been doing, 107%. That 107%, I hope folks understand, is a result of a lot of work that goes on behind the scenes. Early on during the distribution of vaccines, when we first found out about the Pfizer doses having an additional dose in the vial, we had already, on the recommendation of our medical team and our pharmacy team, ordered additional syringes, 25 gauge syringes. That allowed us to put that additional syringe in the ancillary kit early on until the federal government ancillary kits caught up with that. In addition to that, it's given us the extra syringe we needed for the Moderna doses. And recently, in a shipment of ancillary kits from the federal government, there were syringes that were lower than the 25 gauge syringe. Fortunately, West Virginia had been proactive, and as the governor pushes us to continue to be proactive and do more and continue to be effective, we had ordered 100,000 additional syringes, 25 gauge needles. Had we not had those, and today are replacing smaller gauge syringes, we would be getting less doses out of the Moderna vials. So again, I just want to highlight a lot of work goes on behind the scenes every day, folks working 16 hours a day to get things done, and the governor continuing to press us to make sure that we lead the nation, not to lead the nation, but to make sure that we get shots in arms to take care of West Virginians and keep them alive. Thank you.
Thank you, sir. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. In following what the governor has said and what Major General Hoyer has said, we continue to monitor closely what's going on around the country and of course, what's going on in West Virginia. We do see that there are COVID viruses that have variations in their genetic makeup, the so-called United Kingdom variant, the South African variant, and now we have a case of the Brazilian variant. And while these viruses do have specific changes, oftentimes in their spike proteins, which is that part of the protein where the virus binds to cells in the body, that it tells us that the clock is ticking for us to continue to very aggressively push vaccines forward in West Virginia, because as Dr. Fauci says and other people, that the way that these variants, these viral variants spread is that they mutate during the time that they're infecting us. So the best way to reduce the potential for them to mutate is to really have an impact on the infections. And as we've talked about, and the governor just talked about, we have seen such a substantial reduction in hospitalizations, which is frankly very surprising given the worry about the December holidays and New Year, where we would have guessed about now we'd be really, really very full and perhaps even surging in the hospitals. And at least my own perspective is that the reason why we're not is because, one, people in West Virginia are doing a great job with the mask and mitigating, but importantly, it's the strategy we've taken with vaccinations. The fact we've vaccinated our nursing home residents, and now we're really aggressively vaccinating our older population. Remember, our average age of death is 77 years old in West Virginia. And if we look at people over 70 years old, that accounts for 77.5% of our deaths. If we look at West Virginians over 60 years old, that accounts for 92% of our deaths. And if we look at West Virginians over 50 years old, that's 97% of our deaths. So focusing on those folks is important. Now, what we're finding is that as we vaccinate people, there is emerging data that's coming more and more obvious, I think, where in Israel, what they've seen 18 days after the first dose of Pfizer, they've seen a 60% reduction in over 60-year-olds as far as hospitalization. Moderna, after 14 days after the first vaccination, saw an 80% reduction in the hospitalization rates and severe illness of their population. And now with the Johnson & Johnson vaccine, you know, we talked a little bit about that vaccine on Friday, and I want to make sure that people understand, I mean, it is a terrific vaccine. When we look at 72% protection across the board, when we started off with this COVID-19 pandemic would have been an amazing single. We would have celebrated left and right. The two mRNA vaccines, Pfizer and Moderna, were just amazingly effective, which for some people made the Johnson & Johnson not quite as exciting. But the really, really exciting thing about Johnson & Johnson, I think the game changer there, is the fact that they saw, and they haven't published this, and we have to wait until it goes through Food and Drug Administration assessment, but they saw an 85% reduction in hospitalizations in their older populations and all of the people that took the vaccine, and nobody that got the vaccine died at 28 days. So that is another amazing result that is really going to help us. Now, the last thing I want to touch on is we did, as we've talked about before, we constantly are assessing for any mistakes or problems or things that we need to fix. And we did have an episode where a person that had received an initial dose of one vaccine got the second vaccine of the different type. And as we look at that person, they're doing fine. And as we look at the Centers for Disease Control, they say in exceptional cases, you can mix the two doses and it seems to be okay. You don't need to revaccinate people. But I think that it's really important as we go forward that people that are watching this are very aware that we are watching every patient, every shot for any challenge. And we're going to continue to work on making the number of complications or any other problems zero. And so as we're watching this person very closely. They are doing fine. And as we look at our federal guidance, this is acceptable. It's not optimal. And so we want to make sure it doesn't happen again. But thankfully, again, this doesn't seem to have caused any harm and really shouldn't. So thank you very much.
All right, thank you, Dr. Marsh. Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, are both joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. Looking at the data on the dashboard, specifically in regards to vaccinations, I was curious, and I didn't know how much of a heavy lift this would be, whether it would be possible down the road to see a county by county accounting for how many people, residents, are vaccinated in each county. I know you guys are working hard on this, and not entirely sure how heavy a lift that would be, but I was curious to know if that was something that's been talked about. Thank you.
General, maybe you can do this one, or Bill, one of the two of you.
Yes, Governor, I'll start and turn it over to Bill, but we can, as the interagency task force, can look to see how quickly we can pull that data, and then Secretary Crouch and his team can look at it for the dashboard going forward. Bill, I'll turn it over to you.
Thank you, Jim. Thank you, Governor. That's a great question. We've actually been working on that for a couple of weeks now. The problem is actually with the VAMS federal system, and we had a call with them Friday. We're being told they will release that information to the dashboard and allow us to see that. We've not been able to actually see zip code information on there or county information on there to get that information. So we've had several conversations with them. Not sure why we weren't able to see that, but they have given us the okay Friday to do that. So we're looking forward to having information on on our penetration rates by county to look and see how each county is doing. And as soon as we have that information available, we will push that out to folks. We'd like to put that on the dashboard, so we'll do that as soon as we can. So Steve, that's a great question. We appreciate that. We will get that information out to you.
Come back to me just a second. I think there's going to be another problem. The way I see it is I think the way this works, you can go across county lines and get vaccinated. So you're going to have another challenge, in this, to be able to to pump out accurate information about what's going on in the county. And I congratulate the general and all the people that are doing the unbelievable work to be in all 55 counties this week. But I just want everyone to know that there's a lot of work going on, and we're trying to get to every place, every nook and cranny. That's what we want to do.
All right, thank you, Stephen. Next to Mark Curtis with Nexstar Media.
And good afternoon, Governor and cabinet members and fellow members of the press. I know it's not a holiday, but you put out cautions for Halloween, Thanksgiving, Christmas, New Year's about large gatherings. Well, here we go again. It's Super Bowl Sunday, and you know that people throw big parties. There are gatherings at bars and other places. So I'd like to hear from the doctors, especially if Dr. Amjad is there, to weigh in on what precautions, the do's and don'ts, once again, for people to enjoy the game while staying safe.
Dr. Amjad, go.
Sure. Well, Mark, we really encourage people to stay within their family units and maybe close friends, and to stay socially distanced as possible. And you're right, Super Bowl weekend is a good time for people to hang out. But, close gatherings, close friends and family, if you can do it outdoors. Of course, here in West Virginia or Morgantown area, it's too cold. So I know I saw a lot of things on TV, people, with restaurants and bars, they're spacing them out even 8 feet, more than 6 feet distances for TVs and stuff. But here in West Virginia, if you're going to celebrate, you want to stay with your close-knit family and friends, would be the recommendations for a Super Bowl weekend. Thanks.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, so I know this morning on some of the morning programs, you made comments supporting a broader stimulus package that would bring, the higher value checks to West Virginians. But Senator Capito is one of 10 Republicans who are supposed to meet with the president later today in support of a smaller, more focused stimulus package. Have you spoken with Senator Capito? Do you plan on it? Do you hope that she comes on board in support of the broader package? Thank you.
Well, I have not spoken directly to Shelley. You know, Shelley does phenomenal work, and I congratulate Senator Capito in every way. I would just tell you this, Charles. I really thoroughly believe this. With the number of people in this country that were hurting and are still hurting today, we will not be able, no matter what anybody says or does, we will not be able to fit the shoe perfectly. We won't be able to do that. And if we put too much in the shoe to where really and truly it's way too big or a little bit too big, it won't be way too big, but if it's a little bit too big, we're still walking, aren't we? But if we don't put enough in the shoe that really and truly, there's no way that you can get it on our feet or our toes are really cramped and everything, then people are still really hurting and they're not able to walk. I truly believe with all in me that it is a crying shame that so many people, the Republicans were locked on, on trying to, per se, look fiscally responsible. And the Democrats were trying to bail out the cities and states on these gigantic pension plans. And if you want my opinion, I am not in favor of either one. Because I'm surely not in favor of a bailout, because that's not fair and that's not right to our people. These are their taxpayers' dollars. But I'm sure also not a believer that what we should try to do is just squeeze, and get it down, and then all of a sudden realize that, we really and truly didn't deliver the goods, and there's still too many people hurting. So from my standpoint, I truly think that our nation right now needs to step up in a bigger way and move forward. That's all there is to it. And I hate it if I'm in opposition to maybe how Shelley's thinking about this, but that's exactly how I believe. And in this situation, I know Shelley's done terrific work and everything else. And I am not for, I am not for a bailout to cities and states and these great big pension funds and everything else. I am not for anything like that at all. But at the same time, I am absolutely for helping our people. And if we can get our people that are out there that are hurting some extra bucks at this time, the way people are going, struggling paying their power bills or their rent checks or whatever, that are due, that they're just agonizing over like crazy, and all the worries that they're having to contend with, and businesses, restaurants, and everything that are just folding all over the place. And this thing has been a cannonball to everybody. But this nation needs a jump start. And really and truly, with the magnitude of the national debt at where it is now, to go a little bit more bold or significantly bold versus absolutely trying to fit our foot into a shoe that's not big enough, I think you go bold.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, it's Kenny Bass with Channel 8 and Fox 11. Thanks for taking the question. This is about vaccine dispersal and handing it out. We've been asked a lot about out-of-state residents coming into West Virginia to be vaccinated. How many instances that are we having, if we've had any, and what's the protocol for that? Along the same lines, how are we doing as far as safeguarding the vaccine supply and the chain we've heard some rumblings about there maybe been some problems, very, very few problems, but small problems with some pharmacists who may have appropriated some of the vaccine in a manner that wasn't approved. And finally, local health departments have a lot of purview over how they hand it out. Last week, the Kanawha Charleston Health Department apparently had a surplus of vaccines and did kind of an all call in some way to get people to come to the Civic Center on a first come, first served basis. And been contacted by a lot of people who felt like that that was unfair to older West Virginians who have signed up and didn't get that opportunity, and it kind of had the feeling of a friends and family plan. So I know that's out of the state's hands, but Governor, could you comment on those situations, or General Hoyer or Secretary Crouch, about distribution, about safeguarding, and about any possible wrongdoing with some of the vaccine supply? Thank you very much.
Thank you, Kenny. General, go, please, sir. Please, sir.
Yes, sir, Governor. So Kenny, I'll go let's try to get them in order here. So as far as West Virginia residents, we do require a proof of residency, whether it's a driver's license or some other form of identification. We are going to understand we are going to have West Virginia employees who we vaccinate who may live in another state. So we cover that with the appropriate agency and make sure that we're vaccinating those who are our employees. For example, a corrections officer or a National Guard personnel who may live in another state. As far as the vaccination piece and our guidance and direction to those that we provide the vaccines to right now is, as you've heard the governor say, age, and we are focused on over age 65, or those specific groups that we've talked to you about earlier related to nursing home employees or hospital workers. We know that particularly with the Pfizer doses, that we have a short shelf life on those. So we continue to ask the organizations to focus on age of those individuals when they do an all call. But if they have additional vaccines and they don't have the folks of the appropriate age, we know that we need to get vaccines in West Virginians' arms so that we can continue to mitigate this spread. And as Clay pointed out earlier, we have other variants coming. And as the governor tells us regular, we are in a race of time to get vaccines in arms. So I hope that answers your questions.
All right, thank you, Kenny. Next to Kimberly Keggy with WSAZ.
Hi, everyone. Happy Monday. I kind of have a two-folded question. So Dr. Clay Marsh, you talked about the mutant strains. We're starting to see several cases. Has West Virginia in particular seen any of those cases? And then as Pfizer and Moderna, it's very crucial that you get that second dose. So with the Biden administration asking and kind of foregoing you to set aside that second dose, how is West Virginia handling this? Are we setting aside second doses to ensure that every West Virginian gets all the vaccines that they need? Thank you.
Governor?
Yes, sir. Go, Doc.
Okay, sounds good. Well, thank you for the question. So as we look at the mutant viruses, we know that at least at this point, we have not defined any of these mutant viruses in West Virginia. We know that there is a case of the South African mutant, I believe, in Baltimore. There are a few cases there's like the UK variants in 33 states, I think now, South Carolina. And then there was one case of the Brazilian mutant in Minnesota, in somebody that traveled to Brazil. But as we look at the virus, we know the virus is not perfect in its replication cycle, so we will see more mutations, and the mutations in the spike proteins are the ones that give the virus an advantage. As I mentioned in my comments at the press brief, it is important that we get both doses of the Pfizer and the Moderna, and we've laid out that time. But I think what's really important for us to all recognize is it does look like getting a single dose of vaccine in people's arm, whether it's the Moderna vaccine, the Pfizer vaccine, or it looks like it will also be very much true with the Johnson & Johnson vaccine, that there seems to be a really substantial protection, particularly 2 weeks after the first injection. So we still want to get the second injection in people's arms. As Tony Fauci and the Centers for Disease Control have said, that it's not absolutely essential that we get them at day 21 days for Pfizer and day 28 days for Moderna. Within that 6 weeks period after you've injected is still sufficient. Of course, we want to continue that schedule as much as we can. But I think the key is, and one of the reasons why we've seen such good data is the great work of our GIADF and all the people that are part of our distribution and vaccination chain, because by getting all these vaccines in people's arms, and particularly our oldest and most vulnerable, I think that's played an essential and critical causal role in reducing our hospitalizations, and hopefully we'll see that translate into reducing our deaths like we saw today. Thank you.
All right, thank you, Kimberly. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I wonder if we know how many people on a percentage basis are passing on their opportunity to get the vaccine. And in those cases, does the department or the National Guard make an effort to try to convince them that it is safe? And finally, maybe a Dr. Marsh question. If you do not get vaccinated, am I reading this right? The only way to really be fully protected, or at least to a good degree, is to continue to wear a mask, and this virus will probably never go away? Governor?
Well, I think General Hoyer, maybe you can do the front end, and Clay, you can do the back end. You know, y'all are going to do it a lot better than I. The only thing I would add is just this. We continue almost daily, and I know all of our people do the same thing, to try to convince people to get their vaccine. No matter if the percentage is 70 or 85 or whatever the percentage may be of the people that have been offered the vaccines have taken it. And a lot of people, now we're having a backlash to where people that didn't take it the first go round, you know, are now saying, oh, no, I want it, and everything. And we're trying to get to them too. And, but irregardless if the percentage is 70 or 85 or 92 or 99, you know, we really need everybody to take it, because, you know, we know for a fact that it's going to save people's lives. But anyway, General, and then Clay, if y'all take over.
Yes, Governor. So, Paul, what we're doing right now is, for example, over age 65. We know based on census data how many citizens we have in that age group. And as we get closer to those numbers, it'll give us a better indication. But right now, in that broader construct, we don't have a good feel for what percentage are not taking it. We do know in nursing homes that the residents took it at a rate over 80+%, but staff was about 60%. But what we did find is, after the first doses had been administered and people saw that the vaccine was safe, we saw a significant increase in both residents who had not taken it and staff who want to take it now. And we are continuing with a maintenance plan, both to get those individuals as well as work to get new nursing home residents and new employees and new hospital employees who come in. So we are seeing a trend for individuals who now see it is safe to come back and ask for it within their age categories.
All right, thank you, Paul. Next to Phil Kabler with.
You were going to say something, I think. Dr. Marsh?
Yeah, I was just going to follow up the back side of the question. So really briefly, wearing a mask is essential, and that's really essential whether you get vaccinated or not. And with the new mutant virus forms, there is, I think, ongoing consideration that people may want to wear two masks, perhaps a disposable mask or a more disposable mask on the bottom, maybe a cloth mask on top to increase the filtration ability. But key is, Paul, as you said, when people have an opportunity to get a vaccine, we really, really hope that people choose to get it. These vaccines are very safe and very effective, and that's the way that we really, really help protect people in West Virginia, as the governor said. But the mask wearing is critical with or without the vaccine. Thank you.
Thank you, Paul, and I apologize, Dr. Marsh. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. I wanted to follow up on the question of the stimulus package. If it comes down to an either or of the 1.9 trillion American Recovery Plan or the $600 billion Republican alternative, Governor, which of the two plans will you endorse?
Well, Phil, I would say, let's be perfectly honest and perfectly truthful. I've not had the privilege to see either plan, and I really am not versed well enough to know how much dollars are really needed. But I have got to tell you that there is a tremendous difference between 1.3 or 1.9 trillion and 600 billion. And really how I would feel is just this. I don't think that America can go wrong being too high. I really don't. I think today America's got to go to the higher number.
All right, thanks, Phil. Next to June Leffler with West Virginia Public Broadcasting.
Hello, so this question is for Dr. Clay Marsh, and we just got word from, we just got word that you will be testifying tomorrow before the House Energy and Commerce Subcommittee on COVID vaccine distribution. So just give me a sense of why you're going to speak to U.S. House Representatives tomorrow, why you were invited, and, give us a preview of what you'll be saying.
Governor, good for me to go?
Yes, Clay, go, please.
Okay. Well, thank you for the question. Congressman David McKinley asked me if I would represent West Virginia and talk about our plan. And certainly, representing the leadership of Governor Justice and our leadership team, including our joint interagency task force, it's really a pleasure. And as Governor Justice has said the whole time, this is an opportunity for us to both, positively represent what we've done, the innovation that we've used, the team work that we've done, the ability to learn and work together and pull the rope in the same direction, along with some of the strategies we've taken. And I think it's really important for us to do that, not only to represent West Virginia, which I hope it will go well, but also to help others learn from what we're doing and learn from what others are doing. So I'm very much looking forward to this opportunity to represent our great state, our great team, certainly the governor and our leadership. But also it's an opportunity for us to continue to work with other states and with our congressional leadership as well as what we're doing with the White House and the Operation Warp Speed Task Force, so that we can bring the absolute best care and best solutions to the citizens of West Virginia. Thank you.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, well, again, thanks to everybody that's out there. And, as the general described, the state police and others that are doing unbelievable work, and whether it be all the different people that I could easily miss and everything, but our healthcare community is unbelievable. Our National Guard, unbelievable. Our first responders, unbelievable. And again, I just thank all of them from the very, very bottom of my heart. Also want to, pay special thanks again today to our revenue people and all the hard work that they put in. We're together nonstop and everything. And, I love numbers. And so it's good being with the great people. And Secretary Hardy's here with us today. And whether it be Mike or Mark or whomever it may be, great work from Ann, that our Deputy Chief of Staff, and unbelievable work from all the people that work, around me and everything, and that are, and there's no point in me going through and naming all the names, but I thank them from the bottom of my heart, because this thing is a team effort, and that's what I love, because everybody's transparent, everybody knows what the right and the left hands are doing, and it makes us work. It makes it really, really work. And the only other thing I would say is Dr. Amjad, gave advice to all all the people out there that'll be thinking about the Super Bowl and getting together and celebrating the Super Bowl. But I am telling you, you really, really don't need to be concerned about the Super Bowl and everything. The final score of the Super Bowl is going to be Tampa Bay 31, Kansas City 20. And you really, really don't even need to watch it, because that'll be the score. And nobody loves Andy Reid and the Kansas City team more than I. I rooted for them like crazy last year, but I hated Brother Andy, but Tom Brady and them are just going to be too much. And so, but anyway, if you want to just take a time off and do something else on Sunday for the Super Bowl, go ahead and do so, because just remember, Tampa Bay 31, Kansas City 20, and hope everybody really just gets a little smile about that. And anyway, nevertheless, thank you, West Virginia. You make me proud.